I'm really excited that we're doing the program because I think that it really gives opportunities for people, you know, to also know, oh, I might be suffering. This is what might be happening to me.
Or my family,
Or my family,
you know.
right.
So my next question is, who takes this? Because like I've always had this thought that every hairstylist
That's
in the
right.
world,
Bartender.
because pardon.
And bartender.
And bartender, exactly, should take these courses because, you know, people sit down and they do their whole therapy while they're styling their hair or while they're, you know, sitting
That's
there and
right.
drinking
That's
away their
right.
sorrows. So who actually does, who is the course for?
And that's exactly who we want to take this course.
Okay.
Everybody.
Everybody.
Essentially, yeah.
Okay.
Right now, I think we're focusing mostly on professionals that are working with at-risk populations. So your nurses, your police officers, your teachers, people that are interacting with these populations that are going to be high at risk daily, but don't have a background in mental health. So shelter workers, people of that nature, where a lot of this information would be extremely valuable and could help them professionally, but personally as well. And we do get a lot of families of consumers in the training and people that you kind of watch them recognize, you know, some of those maybe disorders in people they know or themselves, and it can be really powerful. So anybody can take this. You don't need to know anything. There's no prerequisites. That's kind of the idea. It's very accessible.
I don't want you to, I want you to please, because of our policies at CAN TV, I'd like you to please just answer me yes or no. Is there a fee associated with taking the class?
Small one.
Okay. Okay, that's perfect. Perfect answer.
We're funded by a grant right now. So
Okay, so that people
the
can
next-
call and they can get that information.
That's right.
There is some kind of a fee, but it's minimal.
That's right.
Okay, that's as far as we go on. Don't ask me why, but that's as far as we go on CAN
That's-
TV.
yeah.
Anybody can take it. Is there an age bracket between?
This curriculum actually is for adults.
Okay.
However, we have done it in middle schools, and we have done it also with child care workers with a federal initiative now in Illinois. It is, you know, the part of eating disorders, depression and anxiety, there's ways that applies also to adolescents. And we have at C4, we're lucky to have 10 instructors. And I think 3 or 4 of us are child and adolescent experts. So what we have also looked at is having diversity in the instructors that we have, and so we have somebody who's her expertise substance use, another one that works with victims of domestic violence. There's child and adolescent, 4 of us or 3 of us are bilingual, Spanish.
I was going to ask, do you offer it in Spanish?
No. Unfortunately, and this is the thing that we're asking the National Council to get this translator, you know,
Yeah,
because
it's in the works.
and you know, and they're working also in more specifics, you know, customizing it a little bit for which we do through. We can't change the PowerPoint. We can't change it's a manualized curriculum that we have to follow to teach. But we do customize our resources and our material. If we're going with law enforcement, or we're doing schools, or the Asian Coalition, I mean, we have taken some things to customize.
Just the examples that you give, you know, that they be culturally relevant.
Absolutely.
Yeah.
Relevant.
That's real important for us, you know, that they be responsive to the population that is taking that. And we have been lucky to get the grant and be able to disseminate it to 600 individuals that we have to do per year. So, I mean, we're really excited about it.
That's very cool. So have you had a chance to get any feedback from people who have already taken the course? Is there any kind of follow-up? Or I imagine when you get federal grants, there's all kinds of follow-ups and questionnaires to fill out, right?
We do have, we do pre and post tests of just to see where they were and, you know, and what they learned.
Where they were, what happened, and where they are.
And at the end, we also do evaluations of us, of the instructors. But the grant also allow us to, and we requested to have an outcome evaluator, because the evaluation studies that we have right now they're from Australia, and I think that some other people here are starting to do that, so we also are doing that for our course, because I think that's going to be important to write for more funding, because this is something that it should be done everywhere. I think of colleges, I think of police, I think of judges and lawyers and bank managers.
Receptionists.
That's
you know,
right, that's
just,
right.
Exactly.
You know, just
That's right.
yeah.
Frontline people.
Yeah, every, you know, the cashier at the grocery store, you know, everybody who's in contact with anybody.
I also want to say that we have in Illinois, there's, I think, over 33 instructors, so it's downstate. There's other agencies that also are starting to do this, which is really great, because part of the mission is to disseminate this curriculum, so it is as common as CPR. So,
Mental
so we're
health first aid.
mental health first aid. That's right. People have said, can you please give us, we can't do 12 hours, can we please do 5 or
Yeah.
whatever. What we have done, though, that we're also very proud, is that to get 12 hours from people, we said, okay, let's look at continuing education credits. So we now
that
have.
was good. That was
so, So we are very proud of that, and we now provide continuing education for nurses, which I think in Illinois now need to have
CEUs.
that.
Yep.
Contact hours for nurses. We give continuing education for educators, the CPDUs, they're called. We have, of course, CEUs for social workers or counselors, and that we were approved. And we have IODAPCA credits for substance use professionals, and we have HR credits.
Excellent.
So, I mean, so for people that need also to meet those requirements, then they're
Sure.
really excited to come, and, you know, at least they get that.
That is so, you're right. You told me I was going to like this. You're right. I do.
You can come and check it out.
Yeah, I would
You
love
know,
to
it's
come and check it out.
We had even we had licensed social workers come. Some people have said it's too basic. Of course, it's
Well,
basic.
you don't go there
because-
for the.
But we had other people that
Right.
said it's a really great refresher, and I like how this is organized, and, you know, and some social workers that might not be working in that setting, you know.
Maybe they're
so-
not clinical. Maybe
That's
they're,
right. That's
yeah.
right. So it's really.
Or just a different take on the knowledge that they already have. We had a testimonial come back from somebody that was a social worker and frankly kind of said, I didn't think I was, you know, really going to use any of this, or that I really learned anything. It was sort of information that I already knew. I am a licensed social worker until, you know, a situation came up when I was not at work. I don't remember exactly what the details
Yeah,
were, but
right.
and she said I used it, and it wasn't really till after I realized I had just used my mental health first aid.
Yeah.
You know, so you do take away different things, even if you're already a licensed professional.
Sure.
And people also get certified as a mental health first aider. So that's a certification that.
For 3 years.
So yeah, it's. I think that the main thing has been algae and applying algae and having, you know,
The technique.
The technique.
The
That's
method to do it.
absolutely, and having practiced it, because we do a lot of like from role playings to they see clip. It's so they practice, and people value that the practice of that.
I think that's fantastic. You know, I'm thinking, you know, funeral directors would be another great population for you. What are you doing for outreach? How are you getting other than being at CAN TV? How are you, how are you getting the people for the program?
You know, with mental health first aid, it sells itself. It's spread. Like I said, we started in 2008 before I was at C4. And just having trained our staff and doing some work with the Asian community, and we were at a shelter. We trained some people there. And then the word of mouth, just like wildfire, because it's very accessible, small fee.
And because a lot of us get really, you know, frustrated, we think, oh, I couldn't think of the right thing to say.
Right.
You know, how many times have you walked away from somebody or hung up the phone with somebody and you know that they're upset and you know that there's a problem, but you don't know what to say or what you should say, or, you know, is it going to be good if I say what I'm thinking, or should I say bad if I tell them, you know, just man up, you know, like there's a time for that, but is this the time? And, you know, I think to have that
Yeah.
kind of training and a basis this and you've become certified to say, I've learned interventions and I've learned how to choose which intervention would be
That's
the
right.
best one for me to use right now.
Yeah, it gives confidence. And I think it allows people to talk about these things that are it's completely okay to talk about and to be informed about what you're saying as well. So you're not guessing and you're not going,
You're just shooting in the dark here and saying, I'm
Yeah.
going to say this and I hope, maybe if I just tell them to man up, they'll just sort of snap out of it.
right.
As we talk about algae, the action plan, we also, I think people love learning how to listen because there's some ways that, when somebody is in distress, that there's specific ways that things you need to do. So learning how to listen is part of the algae, and again, where to refer.
Right.
And where do you refer?
We refer to appropriate professional help. Places like C4 or other mental health agencies, or we also talk about primary care physicians, and we hope to train some primary care physicians.
And that's
on
part of
this.
being a good, I'm sorry, that's part of
That's
being
right.
a good mental health worker is saying, you know what, this looks like a depression that could use medication. Have you talked to a psychiatrist about this? And
That's right.
well, what's the difference between a psychiatrist and a psychologist or a social worker?
Right.
Just being that person in your little world who people can go to and get the right answer about that.
That's
I
right.
always say that, I don't think it's any of our responsibility as an individual to save the world, but I do think we each have an obligation to impact our world. And
that's
this
right.
sounds like
That's
a
right.
really great way to be that person in my little cluster who
Yeah.
knows.
I mean, the program won't teach you how to diagnose or be a counselor or therapist, but the program will teach you how to identify early signs of some cluster of signs of something that can really be serious.
Very good. I could just talk to you all day. Thank you so much. We want to congratulate C4 for being with site and thank both of you for being here to turn us on and share it with us.
Thanks for having us.
I'd like to thank my guests, Viviana and Jessica, for joining us. You've been watching CAN TV Community Forum, a community service of CAN TV. Tune into Community Forum every Saturday at 8:30 p.m. here on CAN TV 21. I'm Karina. Thank you for joining us.